Mema akwaba emra DANNYCOM apomuden kyerɛkyerɛ so. DANNYCOM apomuden nkyerɛkyerɛ so. We just started. So if you are joined, you can share the link. All right. Those watching on YouTube, welcome. Those watching on TikTok, you also welcome. All right. So in Tiamwa, you've joined. Dorothy, welcome on TikTok. In Tiamwa, you've joined. Welcome again. So you can share the link. This is DANNYCOM talk show. DANNYCOM health talk show. DANNYCOM apomodin interest. On this show, we open your eyes concerning some petty things that you are supposed to know when it comes to your health. So all those that have joined on YouTube, welcome. If you have joined on Facebook, welcome. If you have joined on TikTok too, you're welcome. You can share the link. And don't forget, this is the #1 JC that has been ranked the best in FIFA 2026 World Cup. Even if my country does not win, we have won the JC ranking. And mamema wakwaba, we apomodin kyerɛkyerɛ a yɛ kyerɛkyerɛ ɛwɔ DANNYCOM so. If you are watching me on TikTok, you can join me or follow me on YouTube, DANNYCOM Studios. Call YouTube, net type DANNYCOM Studios, okay? All right, so just the link or share the link. Those watching from TikTok, you're welcome. From TikTok, you're welcome. All right. So very soon we will start a live. And in today's video, we are going to talk about ulcer. In fact, on DANNYCOM Health Talk Show, we discuss a lot about health and it-related issues. So if you are watching me on TikTok and this is the first time you are joining me, you can follow me on YouTube as well, DANNYCOM Studios. All right. So we are going to talk about health. And in today, we are going to discuss about ulcer as a disease. Ulcer as a disease. And so if you have questions or if you want to kind of understand what an ulcer actually is, you can send a question in the comment section if you are on TikTok or if you are on YouTube. All right, so we are going to discuss ulcer as a disease. So before we start, as I am saying, if you have any question concerning ulcer, if you don't understand anything about ulcer, or you want to really understand what an ulcer is, the symptoms of an ulcer, and then how to prevent an ulcer as a disease, you can kindly send a message in the comment section, okay? Or if you want to understand what causes ulcer as a disease, you can send a message in the message box or the comment section. If you are following me on TikTok and you want to kind of follow me on YouTube, you can just go to YouTube and type DANNYCOM Studios and you will be given the link. You click on the subscribe and then you will be turn on the notification bell. All right, so let's start. It's now 10:57. Exactly 11 o'clock we will start. Exactly 11 o'clock we will start. So you can just join the conversation if you want to. All right, if you want to, you can just join the conversation. Those watching from YouTube, we are discussing ulcer as a disease and what it causes ulcer, what or how to prevent ulcer, and then also some of the symptoms that will let you know that you are having an ulcer as a disease. Okay, so very soon in the next 2 minutes we will start the conversation. All right, so we are talking about ulcer, and let me remind you, going forward I will be coming your way with the talk show, and it has been called DANNYCOM Health Talk Show. You can ask me any question concerning your health. You can ask me any question concerning your health. If you are going through certain kind of disease or problems, and I say be how poor, you can private chat or WhatsApp me, and I'll give you help or guidance. Okay. Until say share me next, I won't share me that. I will Facebook and TikTok. Open say home with the bia, wait me follow me. I will your friend saying YouTube DANNYCOM Studios. About 11 pepepa, your best start here in Comodino. Na Comodino ene efa ya na pomodin ho. na pomuden no de na ye kasa afa ho ye kasa afa ne ya to din se ulcer ho ye kasa to ne ya to din se ulcer ho ulcer ya yare boni ulcer to me kum nipa. The last time I saw the youngest person that was, is it 23 years old, and the person was a police officer, a very nice and gentle police officer. Oba, also na ekuno, and the also we yare boni, nti na ye be kasa fa also. All right, so exactly 11 in the next 1 minute we will start, and we will look at what an ulcer is, what causes ulcer, and then how do we prevent ulcer. What are some of the things that you're supposed to do so at the end of the day you don't get attacked by ulcer? It's a very dangerous or serious disease that you must take, a very careful look at. All right, so now, as I said, let's begin. It's exactly 11 o'clock. If you have joined, we are discussing about ulcer as a disease. So in the first place, what is an ulcer? What is an ulcer? A lot of people have been saying, me well, ulcer, I have an ulcer, it seems I have an ulcer. What is an ulcer? Let me break it down for you. So if you say ulcer, it's a sore or a wound that forms inside the body. A wound that forms inside the body, most commonly in the lining of the stomach. Okay, so ulcer is something that happens normally in your stomach. Ulcer yare is si ewo ye nipadua mu, especially yen yefunu mu. That is where ulcer normally happens. So let's take it this way. To say let me say you have something like this, okay, and there is a lining on it. There is a lining on it. As soon as that lining wears off, so adeɛ na ɛkata ho no efiri hɔ kwa ɛkwan ɛba bɛda hɔ. When that space that has been created in the stomach start coming or damage, say when we say edia bibi saying bibi kata hɔ, bibi kata hɔ. So when that thing start wears off, or when it starts going, gradually, you begin to experience, let's say, a damage in the stomach. Okay, and this is a way of protection na ɛwɔ hɔ, lining na ɛwɔ hɔ na ɛsɛ sɛ ɛbɔ wo yɛfunu no mu ban no. The saa protection no start say wear off kakra. It creates a space in your stomach or your tummy, and at the end of the day, all the stomach acid that creates in the stomach at the end of the day there is a lining, and that lining that protects your stomach, let me say a lining bi wom. So when that lining wears off, acid biya ebeba nipadua ni mu no, it creates a wound, ekuro ewo yefunu ni mu. So at the end of the day, nsuo tomu a ebeye wo ya, aduane tomu a ebeye wo ya, bibi biara ebeto wo yefunu mu no ebeye wo ya. So as soon as you start experiencing that, whenever you eat, you feel pains. Whenever you drink water, you feel pains. Whenever you drink, let me say, any kind of drink, you feel pains. You are at the point of, say, having an ulcer. I don't know if the introduction is clear. A situation whereby you feel like when you eat, you feel pains. When you drink water, you feel pains. When you take in anything liquid or even solid, you feel pains. You are gradually getting what we call an ulcer. So you have to pay a critical attention to your health. All right. So in simple terms, when the lining inside your stomach wears off or gets damaged, anything that comes into the stomach and is of an acid nature, it creates pain. So let's look at some common causes of this ulcer that we are talking of. A DNA ulcer pa eba. A DNA ulcer eba. And you might be brain a day ulcer eba. To say the marker chon. It didn't kind of say what yes, or in the first place, you are supposed to understand that when the lining inside of your stomach gets damaged, the stomach acid that is in your stomach, anything that is acid in your stomach, creates an open wound. And as soon as an open wound is created in your stomach, you are going to get what we call an ulcer. I know. we have a lot of ulcer that we can talk of, but before we continue, look at this. So at the end of the day, te ekronya beda wo yam, ekronya beda wo yam a wodidi a wonya ulcer, onum nsu a wonya ulcer. So at the end of the day, if you are not lucky, that thing that we call ulcer gradually can lead you to your early grave. It can lead you to your early grave. You understand? All right. So let's continue. Let's look at some common causes. Some common causes of what? Ulcer. And nneɛma bɛn na ɛde ulcer ɛba. Nneɛma bɛn na ɛde ulcer ɛba. So what I say? At the end of the day, wodidi a ɛkɔm de wo. Wonom nsuo a ɛkɔm de wo. What brings that particular pain that when you eat you get, when you drink you get? All right. So there is this thing called frequent use of painkillers. Frequent use of painkillers. Number one cause of ulcer is frequent use of what? Painkillers. So at the end of the day, if you are somebody that when your head is paining you, you go for painkiller. If your stomach is paining you, you go for painkiller. If your body is doing you something small, you go for painkiller. Be careful. Be careful, because painkillers are number one cause of what? Ulcer. So if you don't learn anything at all, if you don't learn anything at all in this our evening classes or DANNYCOM Health talk show, know that the number one cause of ulcer is frequent use of what? Painkillers. Example, ibuprofen, aspirin, diclofenac. When your head pains you small, you go for aspirin. When your head gives you something small, you go for ibuprofen, you go for diclo, and all those kind of things. Gradually, you are going to end up getting what we call ulcer. I don't know if you are getting me. I don't know if you are getting. If you have joined me on TikTok, you can follow me also on YouTube to subscribe to my page. All right. Double tap on the TikTok account as well. Double tap. Double tap. If the conversation is going well for you, double tap. Okay. Double tap. Number one cause of ulcer is frequent intake of what? Painkillers. Mama example say example of painkillers are etumi yenya ulcer. Ibuprofen, diclofenac, what do we call it? Aspirin. All those painkillers that you can think of. At the end of the day, if you don't take care, they are going to end up making you get what we call ulcer. In the ulcer way, enye yare a ɛsɛ sɛ wodidi agorɔ. Ulcer can kill you. Ulcer can kill you. So take good care when it comes to your health. Ulcer is not something you are supposed to joke with or play with. We are looking at common causes of ulcer, and we realize that number one cause of ulcer is what? Frequent intake of what? Painkillers. Number two, adeɛ ɛsɛ sɛ wohyɛ ne nso sɛ woanyɛ careful a ɛbɛtumi ama woanya ulcer. Ɛbɛtumi ama woayɛ ulcer. Ɛbɛtumi ama woanya ulcer ɛyɛ smoking. Okay. If you are somebody who likes smoking a lot, remember I have explained from the beginning that your stomach has a lining in the inside of your stomach. There's a lining. When that lining gets broken or damaged, there's going to be a wound. Say that lining na ɛwɔ wo yam no ɛsɛe a ekuru ɛbɛba wo yɛfunu no mu. Ekuru ba wo yɛfunu no mu a, when you take in food ɛbɛyɛ wo yɛ. When taking water, you feel the pain. You understand? So if you want to critically avoid this thing, what you are supposed to pay attention to, and I say idea this are also a frequent intake of what? Painkillers. I know your point number one. Point number two, what you are supposed to also avoid if you are somebody who smokes is that you have to reduce the rate at which you smoke. the rate at which you smoke. If not, at the end of the day, you are going to get what we call ulcer inside of your stomach. All right. Anytime you smoke, line in there what we line in there what we it is going to end up being broken or damaged. And when that lining inside of your stomach get broken or damaged, you are going to end up getting what we call stomach wound. And when you get the stomach wound, that is what we call or we term as what? Ulcer. Ulcer. Menum nsu a meyam yam ya. Medidi a meyam yam ya. Meyesi a meyam yam ya. All right. So if you have gotten the concept of the meaning of ulcer and the causes of ulcer I've mentioned two. One is frequent intake of painkillers, and two, those who smoke, they are at risk of getting what do we call it, ulcer. And point number three, heavy alcohol consumption. Those who smoke, you are at risk. Those who also take alcohol, you are also at risk of getting what we call ulcer. And remember, ulcer can kill you. Why can it kill you, or how can it kill you? When the lining inside of your stomach gets broken, there's going to be a wound inside of your stomach. If that wound is not properly taken care of, it is going to gradually eating up your intestines, and it can lead you to your grave. We are talking about ulcer, and it is very critical. You have to pay attention to it. Yeah, cassava ulcer. If you have joined on TikTok, you can follow me on YouTube as DANNYCOM Studios. You double tap on the TikTok screen if the conversation is really, going well. Say conversation na komona yi when ni ho. At the trainer ye trainer na say the trainer is and when ni ho, double tap on the screen. If you are on TikTok, double tap on the screen. Double tap on the screen. What I say? So causes of ulcer, frequent intake of painkillers, and then number two, those who smoke a lot, you are going to get or end up getting ulcer. Those who take a lot of alcohol too, you are also going to get a lot of issues when it comes to the lining inside of your stomach. You can end up getting what we call stomach wound, what most people refer to as what? Ulcer. And so reduce your alcohol intake, reduce the number of painkillers. If you are smoking, also reduce the number of smokes that enters your stomach or your tummy. All right. Stress may worsen symptoms, but it's usually not the main cause. Stress. So if you are somebody who always go through stress, it's kind of going to worsen the situation when you have it already, but that is not a cause of ulcer. So if you have already developed or gotten ulcer in your system, when you are stressed, okay, it worsens the situation. But stress in itself is not a cause of ulcer in your body. And the hypertension say we will be a bread unya daje ma wo nipadua as a time bia why you busy and non nkyerɛ wobɛtumi anya ulcer, but sɛ woanya ulcer dada ɛwɔ wo nipadua mu a woanya ulcer dada wɔ wo nipadua mu a, at the end of the day no wo stress wɔ ho no wo ma situation na ayɛ worse. Situation no ayɛ worse. Yeah, kasa fa ulcer ho. We are talking about ulcer, and this is DANNYCOM Health Talk Show. There are some things that we want to open up for you to understand when it comes to your health. Right? A lot of people are dying young. A lot of people are going, to their grave too early. The obituaries and gone too soon are all as a result of some lifestyles that we were supposed to live and we were not living. Okay, so at the end of the day, a lot of people are joining their ancestors too early. As I said, we come up with a lifestyle modification, a lifestyle that we are supposed to live, that at the end of the day it will help people live older a bit. Our forefathers and all those people were not doing certain things, but they were living long. Okay, they were living long and even longer. There are some things that we are supposed to do when it comes to our health. And today we are discussing about what? Ulcer as a disease. And I have explained what causes the ulcer, and then we are now going to look at some common symptoms of ulcer. What are some of the things that will let you know that in fact this condition that I am going through is like I am getting what is called stomach wound, what most people refer to as what? Ulcer. Are you getting it? A lot of people, the wound inside of their stomach, they call it ulcer, which is normal to the layman. But then to the people or to those of us who are in the medicine or in the medical field, we know it's a wound that has been created in your stomach. The lining has been damaged or broken. Okay. So at the end of the day, if you have taken too much painkiller, if you have been taking too much alcohol, if you have been taking too much, smoke or cigarette, and you have ended up getting this thing called ulcer, how do you tell or how do you know that in fact you have been infected with what? Ulcer. So we are going to look at symptoms of what? Ulcer. Double tap on the screen if you're on TikTok. Double tap on the screen if the conversation is actually going well with you. If you like the teaching, just double tap on the screen for me. Follow me on YouTube as well, DANNYCOM Studios. Just go and tap DANNYCOM Studios and follow me as well. We are discussing ulcer as a disease. Ulcer as a disease. And so if you are interested in joining those of us on TikTok and you are health personnel or professional and you want to share your views as well, you can just co-host by sending a message. Okay, so let's look at symptoms of ulcer. What actually will make you know that in fact I have gotten an ulcer, and then I want to kind of examine myself and see whether it is true that the thing that is happening in my system is actually true, that it's an ulcer. So symptoms that will let you know that you are an ulcer or a patient with an ulcer or stomach wound. All right. One, there's going to be what we call bloating. Bloating. You understand? Bloating. Most at times, you feel like there's nausea. Let me mention them one by one. I will explain to you. There's bloating, there's nausea, and then there's feeling of what? Full quickly. You feel like things are not going well in your system. Sometimes there's pain in your abdomen, not the lower part. And when it comes to your chest aspect, you won't say you feel that sharp pain. You feel that sharp pain when it comes to, let's say, the middle of getting to the end of your rib. You feel that sharp pain. So as soon as you begin to feel that sharp pain in your chest area like that, you begin to examine yourself very well. Before you realize, you are gradually getting to the stage where the lining in your wound, your stomach is what? Getting damaged. As soon as that thing happens, there will be a wound in your tummy. And to be careful with how you take in painkillers and other things. Some of the things that you go for painkillers for, they are not actually demanding painkillers. They are demanding something different, altogether. All right. So if you have just joined from TikTok, double tap the screen. If the conversation is going well, just double tap. We are discussing about health, and today we are talking about DANNYCOM Health Talk Show, and the topic is discussing ulcer, ulcer as a disease. And we have explained what causes ulcer, and we have given you the meaning of ulcer. We are looking at the symptoms of ulcer. What will actually make you know that I am in fact having an ulcer and I need to treat it very fast? And remember, ulcer can kill. Why ulcer can kill? Because ulcer is caused by the damaging or the removal of the lining in your stomach. So when that lining in your stomach is being broken, there is a wound in your stomach, And when that wound is there for long, it will gradually eat all your intestine, and so it can actually kill you. It can actually what kills you. So you have to be careful when it comes to how you handle ulcer. And we have mentioned that at the end of the day, if you are not careful, the same thing that I'm going to mention will let you know that don't buy any painkiller. Remember, if you're an ulcer patient, you can't even take any drug or all kinds of drugs. There are certain drugs you don't even have to take because they are going to worsen the situation. You can't take ibuprofen, you can't take you can't take some painkillers like diclofenac and aspirin and stuff. So you have to know your situation before you go into the pharmacy or even the drugstore to buy a drug. If you find yourself in in the case that you always get a sharp pain around your chest, sometimes it can even be your back. At your back, you feel that sharp pain. When it happens like that, and I said, Basa, don't think that you are having a normal body pain, and so you are going to just buy painkiller. Examine yourself before you even walk into any pharmacy or drugstore to buy painkiller. Ulcer is dangerous, and ulcer can actually kill. And ulcer is caused by frequent painkiller taking, frequent smoking, frequent alcohol, and all those stuff. All right. A lifestyle modification, a very good lifestyle modification can, help you if you want to actually stay healthy when it comes to this disease we are talking about, ulcer. Sometimes another cause, or let me say another symptom, is this: you kind of get a severe vomiting of what blood or passing of black stool. So if you have an ulcer, one symptom is sometimes you can vomit even blood. There is a wound in your tummy, or there is a sore in your tummy, and that has gradually eaten up your intestines and is now coming out as a form of what? Blood. So be careful. As soon as you get to that level, you are, at the point of needing a medical attention. You need a medical attention. As soon as you vomit blood, or when you pass out black stool, you understand? It is giving you a sign. It is giving you a sign that your ulcer has gotten to a different level. Okay, we have different types of ulcers. We have the peptic ulcers and all those ones. But I'm just giving you the intro. What an ulcer is, some causes of ulcer, some symptoms of ulcer, and then maybe how to prevent, the ulcer we are talking about. Double tap the screen for me, those on TikTok. If you want to follow me, we'll be doing this program going forward, sometimes on YouTube and sometimes on TikTok, and sometimes you do the two together. So just follow me on YouTube. Just go to YouTube and search for DANNYCOM Studios. Search for DANNYCOM Studios and follow me. Help the family grow. Help the family grow. But you, Evans, welcome to TikTok. In fact, it's been a while. Thank you. Juliana, welcome. Efiasewa, welcome. And then Abudu Razak, thank you for joining. I really appreciate you all. Magdalene, thank you for joining on TikTok. Follow me on YouTube as well, DANNYCOM Studios. Thank you all for joining. John, thank you for joining. And then also that of Dachihne, thank you for joining on TikTok. Ophelia, thank you. Pastor Christia, thank you. You can just double tap on the screen to just, show that you really love what we are doing. So we are talking about ulcer. So far, so good. I want to see if there are some questions before we move on to how can this ulcer we are talking of be treated. How can it be treated? So if you have a question that you want to understand when it comes to ulcer, maybe there is something bothering you. Somebody will say, when I take in orange, or maybe when I take in pineapple, my stomach pains me a lot. It's not about the orange or it's not about the pineapple. If you have ulcer, anything you take into your stomach will pain you, because there is a wound in your stomach. There is a wound in your stomach. So at the end of the day, anything you take in there, you are gradually going to get that pain. But sometimes, because the pineapple and that of, let's say, the orange has a lot of acid content in them, it kind of make the sore, go through some severe pain. That is why people say mefa anka ana mefa abroba na me yemede eyemia. But in reality, if you even drink water and you have ulcer, you still get that pain. You understand? If you even take drink and you have an ulcer, the pain will still be there. The pain will still be there. So at the end of the day, if you are an ulcer patient, all you need to do is to visit the hospital or visit the pharmacy. All right. So waiting for some few minutes. If there are questions that you want to understand when it comes to your health with regards to especially ulcer, if there are questions before we move on to how to treat ulcer. So just some few seconds while waiting for questions. Those on YouTube, you can send in the comment section, and those on TikTok too, you can also give us your question and we will attend to them in due time. All right. If this thing is nice and you want us to move on along with this every day, just double tap on the screen to encourage us. Share the invite as well. So at the end of the day, it kind of motivate us all. All right. So let's look at how one can treat ulcer. Let's assume that unfortunately enough, you have an ulcer. Okay, unfortunately enough, you have an ulcer and you have been battling it out. What are some of the things that you can do to, kind of reduce the stress on the sore in your stomach? I don't know if you are getting it. So we are looking at preventions. Yes, preventions. So the number one thing you are supposed to do when you want to treat ulcer or you want to prevent ulcer in your body system is there are some drugs that actually reduces the stomach acid. There are some drugs that actually reduces the stomach acid, and those are the drugs that you are supposed to kind of be taking. So example of the drugs, you can visit any pharmacy, you get yourself a Nugel O or Nugel or the antacid, the Ulcers. They are all drugs that can reduce the stomach acid. So you get your Nugel, you get your omeprazole, you combine these two drugs together, and at the end of the day, you are going to be fine if only your kind of ulcer has not gotten to a certain level. As I mentioned, we have types of ulcer. Okay, so if your ulcer has not grown to a certain level, and let me say you are now developing it gradually with the Nugel O, with an antacid or a Nugel itself and omeprazole, you are good to go. All right. So medicines that can actually help you reduce the pain or the stomach acid in your body system. One is Nugel and one is that of Nugel O, and then also omeprazole and all those things. All right. So at the end of the day, if you have ulcer, take it from me. You can just walk into any pharmacy and just get yourself a Nugel O, get an omeprazole, and then let them prescribe it for you accordingly, and then you will be fine. All right. So there are some antibiotics. Okay, antibiotics too in H. pylori infectious is present. Okay, antibiotics if H. pylori infection is present. So if only your condition of ulcer or your state of ulcer, there is an H. pylori. This one won't see where I say. So just take it that anything that has H. pylori in your body system, you go with antibiotics. So you have taken the nodule, you have taken the omeprazole. After some time, you still receive that severe pain. It means there is some H. pylori kind of infection in your system, but you don't know. Visit the hospital or the chip compound and say you want to do H. pylori test, H. pylori test, and they will be able to tell that your ulcer has an H. pylori present in it. So they will be able to give you antibiotics. The antibiotics is also a drug. Okay, antibiotics is a drug. But initially, if yours has not gotten this H. pylori infections in them, nugel O, omeprazole, and all those kind of things will solve your issue for you. Just be consistent. All you need to do is just be consistent with the taking of the drug, omeprazole, nugel O, and all those things. Just be consistent. All right. But when the situation keeps continuing, then that is where you visit the hospital and do H. pylori test. And when they see that there is an infection of that H. pylori component in you, then they will add you what we call antibiotics. You understand? So those on TikTok, just double tap for me if you are getting the concept, and then you can also share the video to invite somebody as well. All right, just share the video and invite somebody. Follow us on YouTube, DANNYCOM Studios, and then God willing, we will be meeting there as well. Also, all right, just double tap for us, just to say that in fact you are appreciating what we are doing. All right, so we are still on the prevention or how to treat the ulcer that we are talking about. How to treat ulcer that we are talking about. So remember, from the causes, we realize that a lot of alcohol and smoking causes, the lining in the stomach to also damage or wear off. And as soon as that thing happens, you can end up getting what? Ulcer. So number one, prevention tool that you can also do if you want to prevent ulcer in your system is reduce your smoking habits. If you are somebody who smokes a lot, if you are somebody who smokes a lot, reduce it. That one is going to help you a lot. If you are somebody who also takes in excessive alcohol, you are gradually going to end up getting ulcer. And so what do you do? Just reduce it. I'm not saying stop taking alcohol or stop taking cigarette or whatever, but then excessive alcohol or drinking or smoking can cause you to join your forefathers at a very young stage. So reduce the number of alcohol you take, reduce the number of cigarettes you smoke, and it is going to help you stay a bit longer or older. Ulcer can kill. Ulcer is a disease that can actually kill or let somebody join ancestors at an early stage. That is why we are discussing ulcer. That is why we are discussing ulcer. If you have question, you can just send your question in the question section. Those of you who have joined TikTok, you can follow us on YouTube, DANNYCOM Studios. Just double tap on the screen for us on TikTok for us to know that in fact you are enjoying the classes. This is DANNYCOM Talk, Health Talk Show. Health Talk Show. This will be coming your way from time to time. We will discuss a lot of things. We will discuss a lot of things when it comes to drugs and when it comes to diseases and our health. All right. So just double tap on the screen for us to know that what we are doing actually is helping. So before we go, if you have persistent stomach pain, all right, something that keeps coming, it comes and go, your stomach, today this, tomorrow that, today this, tomorrow that, and you have unexplained weight loss. Every day you reduce in weight, There's something actually going on that you don't understand. Sometimes you even vomit blood. You should see a healthcare professional as soon as possible. As soon as possible. As soon as you begin to see these symptoms that I mentioned, don't sit down, don't relax. Go and see a health professional. Visit the hospital, visit the pharmacy. Don't fear, they are your friends. Talk to them, discuss issues with them, let them know what is happening. If you enter pharmacy or hospital and you cannot share your health information, in fact, you cannot share it in the church, you cannot share it among your colleagues at the bar. It is the pharmacy, the doctor, and then the hospital environment you can share. So anytime you go to hospital, feel free, let them know what is actually happening in the system so they can help you out. All right. So they can help you out. You feel like persistent stomach pain, visit the hospital. You feel like your weight is gradually coming down, visit the hospital. Sometimes you vomit, visit the hospital. Avoid buying those painkillers every day whenever you feel unease. Ulcer is a disease that can actually kill. So remember that at the end of the day, you are not going to be depending on those painkillers, because they can actually cost you your life. All right, they can actually cost you your life. So you have to kind of stay, I mean, careful when it comes to uh this ulcer that we are talking about. Let me see if we have any questions so far in the comment section. If you have any questions so far in the comment section, if you have a question, just send your question in there. If you have a question, just send your question in there. Follow us on TikTok. I mean, go and follow us also on YouTube if you are not following us on YouTube. If you are not following us on YouTube. So I mentioned that we have a lot of ulcer, or a lot of, I mean, categories. Let me put it that way. Different types of ulcer. Some can be peptic ulcer, and that one has to do with the digestive system. That is where your intestines revolve. Your gastric ulcer, like these occur in the stomach or your small intestines alone. The one that is the peptic ulcer. So when you have the peptic ulcer, everything that evolves around your intestines, all right, everything that evolves around your intestines, that is the people that have this type of, I mean, the peptic ulcer. You understand? We also have those that have mouth. Ulcer can also happen in your mouth. So we have mouth ulcers, small painful sores inside the cheeks, the lips, the tongue, and the gums, and all those things. So if you are experiencing those things too, there is possibility of you having an ulcer in the mouth. All right. So ulcer has different types. So don't just walk inside the pharmacy and go and buy any painkiller when you feel pains. Okay. The one in your mouth can even cause you headache. And if you go and take paracetamol for that headache, it is not going to do anything because it is an ulcer. It is not a normal pain, I mean, headache that you are going through. All right. So if you have questions, you can still send. We also have those that can even get skin ulcer, and that one is an open sore on the skin that heals slowly. They normally heals slowly, but then it's an open sore on the skin. All right. So as I said, ulcer has a lot of types, but the most important thing that I want you to learn tonight is one, ulcer is caused by, I mean, excessive and then persistent painkiller taking, smoking, alcohol, and then other things. Whenever you see symptoms of sharp pain in your lower abdomen, or let's say your chest area, visit the hospital or the clinic or the pharmacy. All right. Anytime you feel there is something going on in your system, don't just do self medication. by going to buy something to solve the issue. Visit the hospital. All right, visit the hospital. Let me see if we have questions so far. Let me see. No questions so far. Just double tap on the screen. Those of us on TikTok, double tap on the screen. Double tap on the screen if you are on TikTok. Just go and follow us too on YouTube, DANNYCOM Studios, DANNYCOM Studios, so that anytime we come live, you get a notification. Just go and follow us on DANNYCOM Studios. So anytime we come live, you get a notification. All right. This is what we call DANNYCOM Health Talk Show. DANNYCOM Health Talk Show. And on DANNYCOM Health Talk Show, we discuss issues relating to our health. We discuss issues relating to our health. All right. So when we come to live on TikTok and then that of YouTube, DANNYCOM Health Show, we talk about issues regarding our health and then that of our life as well. Remember, if you have health or if you have good health, you have good wealth. Your health is your wealth because your money will be free from drugs. All right, so let's see if we have questions in the comment section. If no questions, we'll wrap up for the day. God willing, tomorrow we will come your way with another topic, and that one we are looking at sexual performance. Sexual performance. So that is going to be fantastic topic. Follow us on YouTube and also on TikTok. So when we come live, you'll be able to get the notification. Sexual performance. We will discuss a lot under sexual performance. Why people are weak, why people are strong, why guys these days want to be using aphrodisiacs for sex, why ladies every day are taking post pills, the Lydia and the post-2 and stuff. Are they good for their health or not? We will be discussing a lot on DANNYCOM Health Talk Show. Some things are there that look simple but are not simple to some people. Hypertension, we have already discussed that one and it's in our YouTube. You can just follow and watch when it comes to hypertension. We are going to discuss a lot when it comes to diabetes, how to manage diabetes. In fact, this is a full program. So just follow us on YouTube and then also on TikTok, and then you'll be given more information. Remember, knowledge is not in one person. So if you have an idea you want to share, you can just come on board and then we help educate the general public together. If there was no question so far for us, we will say thank you very much to all those who joined and then also stayed with us up until this time. If there's no question so far, if there's no comments for us to read, then we will say a very big thank you to you all who followed, to you all who joined, and then also to you all who shared our live video. But Evans, thank you. And then also that of Solomon Atta, thank you. Gloria, thank you. Ayamga Idrisu, thank you. Sam Limina, thank you. And then we want to say thank you to you all. Charles and then Hobbies, we are grateful for you. Joining Sewa, Papa B, and then Philip. We are grateful. We are grateful. We are grateful. We want to end the live session here. If you